If you've lost your teeth, you probably ask yourself, should I get dentures or dental implants? Well, both can restore your smile, but it's a very different solution between both of them, unique advantages and drawbacks. In this episode, we're going to discuss and compare dentures versus implants. Before I continue, make sure you put code DENT101. We are at the 101st episode to get a complimentary consultation from our office in Princeton, New Jersey, and soon we're going to New York. And make sure you like, share, and subscribe this episode for yourself and for your loved ones or family or friends. For you who don't know me, my name is Dr. Radwa Saad. I am a dentist. I place implants. I'm a cosmetic dentist, and I've been doing dentistry for over 20 years. We are in Princeton, New Jersey, and I am here to help. If you have any questions or comments, make sure you put them in the comments here below, and I will take care of them personally. But first, let's talk about dentures or implants, or what should you do? This is a question I get this every single day in my office. A lot of patients, they will come in and be like, pull all my teeth, give me dentures. And I'm like, do you know how, it can be a little bit different. So what is a denture? What exactly is a denture? I made an episode about dentures and types of dentures, and I made another episode about implants and basically all you need to know about implants. So you can take them both, as a reference. But today, dentures is basically, it's removable. It's a removable appliance. It's fake teeth and it replaces missing teeth. So there are different types of dentures, and there are different types of restoration with implants too. So really it all depends on the numbers of missing teeth, and it also depends on your health, and it depends of what we have, like bone and gum health too. Do we have bone or we don't have bone or what? But basically a denture it's a removable appliance. It's removable, it's not fixed. So you always remember that. Now, what are the pros of a denture compared to cons? Like, why is denture, it's an affordable solution. It's a very affordable solution compared to implants. It needs a little bit of time compared to implants. So a denture, a complete denture or a partial denture, it takes around 2 months from start to finish. Implants takes much longer than that. That's one. Two, there is no invasive procedures at all with dentures. You already have missing teeth. We just take impressions or scan your teeth, send them, or if we have a 3D printer, we 3D print them, and basically we have them ready. Implants, on the other hand, it's a little bit of a surgery. And of course, depending on how much bone you have or the condition, or if you have a sinus problems or if we need a sinus lift, it's a small surgery. A complete denture or a partial denture, it can replace few missing teeth at once. Like if you have no teeth at all, okay, upper denture or lower denture, you're done. Couple missing teeth here, couple of missing teeth here, it's one partial denture and you're done. And as I said, you have flexible choices from the partial denture. Go back and check my episode, but you have like the metal or the cast partial denture versus a resin partial denture versus a flexi partial denture or the Valplast versus an immediate denture. And it can restore the speech and appearance. Okay, it's pretty much easy to get them done. Is it easy to get used to them? Not that much, unless if you had it from before. So this is one of the biggest problems. Sometimes it's not easy to get used to them. If you have the will, you have the power to try to get used to them. That's one. But if you have also like a gagging problem, that could be sometimes very challenging. Sometimes, it's a removable appliance. So you're eating, you're chewing, and sometimes it's kind of moves, like patients like, oh my God, I was talking and it moved a little bit. It's removable. That's especially the lower denture, they move a lot because of the tongue. The tongue is like, I have a big space. Let me just do stuff. So sometimes, I tell the patient, you can put a little bit of an adhesive, that little denture glue. You don't put a lot, don't fill the whole thing, just put a little dot, and I always tell them, make sure you dry the inside of your denture and you dry the tissues before you put a little dot, and then you put it and you bite so it spreads and it basically, it makes it stay. And don't sleep with it. You have to take it off after every time, you eat or you drink, and you have to clean it. And if you're using the glue, you have to clean that glue every day. Don't stay with it and sleep with it, and then you're going to end up with a lot of problems. You have to take it off and clean the glue off of your teeth, not the teeth, the inside of the denture, and your gums too. They have to be cleaned up. But the bigger problem really of dentures compared to implant is bone loss. So the more you eat and chew with the denture, the bone underneath it, it starts to resorb. Whether it's on the top, it starts to shrink away, followed by the gum. Now we had a really good fitted denture, and then after a few years, it's not fit anymore. It's loose, it's rocking. I'm getting more food stuck underneath it. It's not comfortable. And why is that? It's because the gum and the bone, they're starting to shrink now, and now we have a space, we have a gap. That does not happen with the implant. The implant actually on the opposite side, that preserve the bone and the gum, they preserve them. But the dentures, because it's removable, it's rocking, so the bone and the gum, they start to shrink. So this is a big disadvantage of dentures. And dentures, as I said, once you start to have that gap, what do? We have to reline. It's usually 5-7 years. So we have to add more material. And if it happens once or twice, then at this point you just get a new one. And because it's removable, sometimes the chewing is not that easy. Sometimes, of course, because it's moving, sometimes the speech, it's good, but sometimes the speech might feel a little bit altered. And it's removable. That's, you guys have to understand, it's removable. So you can have the best aesthetic. It looks fantastic, but it's removable. I've had patients who eat everything with dentures. They eat corn on the cob, they eat apples, they eat everything. I have other patients, and I made this and I made that. They're like, every time we eat and chew, it's hard. And why is that? Because it's all depend on how much bone and the basically the structure that we have that we're trying to build on it. So if you waited too long, you don't have enough bone, especially here, lower jaw, that's going to be a big problem because we call it a flat ridge. We need bone so that the denture can basically sit on it. The top, we don't have much of a problem because it sits on a higher on the roof of your mouth, so we have more stability. But the bottom, if you wait too long to place a denture, then the bone starts to really shrink, and then we have no options but like, okay, you have to glue it or get an overdenture. What is an overdenture? You have to go back. I'll talk a little bit about it too. But these are basically what's a denture. And as I said, there are full denture, partial denture, immediate denture. Immediate is when we pull teeth and we put it, have the denture ready or, ready made. Now, what are the dental implants? So the dental implant, it's like a root. And the majority is made of titanium. Some of them are made of zirconia. And it's like a little root that we put in, it's a small surgery. We put it in the bone and then we wait for the healing until we can put a tooth on it or fix, the missing spaces. So is it effective? Yes, it is. Of course it is. But the big problem with an implant, of course, it's not as affordable as a denture, so it is more expensive because it needs time and it needs expertise and it needs a lot of material that comes with it. A lot. Like if you need like a bone grafting, or if you need a membrane, or if you need healing to happen, or it's like a lot. And the main thing is we need a little bit of more time to have that implant attached to the bone before we can put something on it. But it feels and functions like a natural tooth. It's a tooth, okay? It's literally a tooth put on like a fake root, if that makes sense. And remember, with the denture, I said the bone and the gum, they start to shrink. That does not happen with the implant. The implant, actually, it preserved the bone where the root used to be. It preserved the bone, okay? And if you are planning to have an implant versus a partial denture, so the partial denture, it sits on, part of it sits on the gums, but then there are hooks that sits on teeth to kind of help, like an anchor. Implants, we don't touch the teeth on the side at all. Okay, it's a single tooth problem rather than in a partial denture, like pretty much all teeth problem. Okay, so you always think about that. And the lifespan is much longer. Nothing is forever. Okay, you have to understand, nothing, we don't live forever, so nothing is forever, but the implant, usually the lifespan is way longer than a denture or a partial denture. Of course, especially if you are maintaining it, of course you have to maintain it. Be like, oh, I have an implant. That's what the patient think, pull my teeth and put an implant. They think, oh, I have metal in my mouth, then nothing is gonna decay, nothing is gonna happen. They don't get cavities, but they get gum disease. So we still have to clean, we still have to floss, we still have to brush, we still have to go to the dentist to get, the 6 month, follow up. Smoking is a big problem, if you have implants, so you have to think about that. Grinding your teeth is another big problem. So you have to think about few things, okay? So the implants are more permanent, they are stable. We don't have that problem, something removable. They have, they preserve the bone, and they have a longer lifespan compared to dentures or a partial denture. But the big thing is they act like your natural tooth. Cons on the other side, they are more expensive. Yes, they absolutely much more expensive. They require surgery. They're more invasive, especially if you have, let's say, no bone. So we have to do now a ridge augmentation first before we can place an implant. If you need a sinus lift on the top, it's an extra surgery, and it's not really suitable for everybody sometimes too. Especially, remember when I said if you haven't had like a socket preservation, or the bone was not kept, the thickness and the height of the bone was not kept properly. So sometimes we have to have a whole extra big surgery just to keep the implant in, to be able to place an implant. And it takes much longer. So an implant from start to finish, just to put one tooth, it takes like around 6 months at least, depending also on your medical history. And that's another issue. So some patients who are taking methotrexate, we cannot pull teeth. I'll be like, we cannot pull teeth, we need to keep. And that's basically, it's a medication that are taking for some sort of a chemotherapy, or sometimes for the osteoporosis, if you have like the bone is fragile. So why is that? Because if we pull teeth now, we try to really maintain the teeth at least for 10 years if you are taking methotrexate. Otherwise, I always tell the patient, you need to go see an oral surgeon. This has to be done in a very specific setting. And why is that? Because sometimes if you pull a tooth and the bone does not heal properly because you are taking this medication, there is no healing. And then not only that, but the bone cells start to die, and then we end up with necrosis, which is crazy. So we don't want this to happen at all. So you always have to give your dentist a full list of all the medications, or even if you're taking aspirin, even if you're taking something over the counter, you have to tell your dentist pretty much all the medications and over the counter vitamins even that you're taking. So now the difference between implant dentures, of course, the number one is stability. There is no way around stability. Implants are way more stable than dentures, of course. And then the bone health, of course, it's, as I said, you are putting a root, and the bone and the gum, they stay around it. So that's an implant versus a denture. Longevity, nothing lasts forever, but the implant, of course, they last way longer than a denture. The denture, as I said, because that bone starts to shrink, so we have to reline, we have to do this. And big one is the comfort. Implant is like, okay, I have a tooth in my mouth, I'm good to go. You don't have to remove it. You don't get embarrassed, oh my God, it's moving. Oh my God, you don't have that problem. It's already solved, it's already in, and it's fixed, it's in. But the cost, of course, the implant are way more expensive than a denture. And with the function, both of them, they do function properly, but the implant, they will allow you to function like fully. You eat whatever you want. The dentures, of course, you have to be careful. But as I said, I've had patients who've been like eating everything they want. So it really depends on you. But as I said, it really depends also on your health. So this is a big one. the bone, if you have good bone to begin with or not. That's another one. How many teeth are missing? That's another one. Because, you know, some patients are like, you know, I have only one missing tooth and they want like a denture or a partial. And I'm like, you just have one missing tooth. Just get, you know, an implant and forget about it. Big time is the financial burden, you know, budget this versus that. What do I do? And whether you want something removable or fixed. But I have to say that sometimes, you know, depending on the budget, you can start with something removable, yeah, and then in the future you can get an implant depending on how much bone we have. So it's a solution, you know. You know, if you have a lot of missing teeth and it's gonna be a big, you know, financially it's going to be expensive, maybe start with a partial, but you have to put something there. Don't just eat on your gums, because the more you do this, the more damage is going to happen to your bone, and then the bone is going to be gone, and then we're like, even with the partial denture or even a complete denture. Now, is there a solution? How can we merge both of them together? So there is a solution. There is something called an implant-supported denture. So remember when I said the top, you can get a complete upper or a full denture on the top, no problems, because you have that roof of the mouth. It's helping it to be stable. It's the bottom. It's always the bottom. It's going to always be moving. I'm talking about a full denture on the bottom. So how can we basically merge an implant with a denture together? We make what we call an overdenture. So let's say you have a full denture on the bottom. We end up putting a couple of implants down here, and then there is a little housing on the inside part of that denture, and they just snap in and they click over the implant, and you have some stability down there. It's not like 100% like, you know, a complete implant supported, you know, like screw retain. No, but it's removable. It's still stable compared to a complete denture just alone. It's definitely will give you more stability and more chewing, and it's gonna prevent, you know, accidents from happening. Okay, so whether you want to do, you know, a denture versus an implant, I hope you understood now the difference between both of them, and then you can make a decision. And as I said, you can send, you know, in the comments here if you have a question or you have something was not clear enough. I'm more than happy to help you identify pros and cons. Okay, but of course it's your decision at the end. And we are in New Jersey and soon coming to New York. If you want a consultation, or even if you want a virtual consultation, we do that as well. Until I see you next time, make sure you take care of yourself and your teeth so that they can take care of you. Until then, keep smiling with Dr. Saad. Have a good one, everybody.